All right, good evening, everyone, and welcome to Brain Awareness Week with the Society for Black Neuropsychology. I'm Dr. Anthony Robinson, and I'm a member of the Education Committee and co-chair of research for the Society for Black Neuropsychology. We're really excited to have you here as we continue our series on the brain in systems. On Monday, we kicked things off with a talk on how to approach brain health holistically. And if you missed it or want to revisit that talk, it's now available on our YouTube channel as are talks from previous Brain Awareness Weeks. Tonight, we're excited to present the second and final virtual presentation of this series. Our speaker tonight is Dr. Marissa Gonia, who will be talking about physical activity and brain health. And joining me tonight and moderating tonight's discussion is another one of our Education Committee members. Jessica, would you like to introduce yourself?
Thanks, Anthony. My name is Jessica Pereira. I am a predoctoral intern in psychology and specializing in neuropsychology, and I'm also the secretary for SBN as well, in addition to being on the Education Committee, and I will be moderating the chat and presenting our speaker with any questions and comments that we have at the end.
Great. Thanks, Jessica. And at this time, I'll go ahead and turn it over to you now, Dr. Gonia.
Awesome. Thank you so much, Anthony. Really excited today to talk with you all about a precision medicine-based approach to physical activity and brain health. I'm an assistant professor and neuropsychologist in the Department of Neurology at the University of Pittsburgh School of Medicine, also part of the Alzheimer's Disease Research Center there. So I'm excited to kind of take an aging focus with this. Feel free at any point to throw any comments that you have into the chat. I'm looking forward to your feedback and questions that you have. Also wanted to take the time just to thank the Society for Black Neuropsychology for the opportunity to present this work as part of their Brain Health Awareness Week. Today I was hoping to just cover a couple things, one being just an overview of the beneficial effects of physical activity and exercise on cognition and brain health, then talking a little bit about what it means to take a precision medicine-based approach to physical activity, and then I thought we could have some comments and questions to make it a little bit more interactive. All right, so this had a little animation where it was lifting up the weights. But I wanted to start by just giving a little overview of this kind of vast body of literature over the past decade that's linked exercise to brain health. And so we know that exercise can do a lot of good things for our brain. One of them being that it might preserve the structure or the volume of the brain. Our brains shrink a little bit each year, especially as we age. And sometimes shrinkage in areas associated with neurodegenerative conditions like the hippocampus are not good, and they impact our thinking. This study on the right, researchers had older adults engage in an exercise intervention for 6 months up to a year. What they found was after the intervention was over, even at 6 months, people who completed the exercise intervention had better thinking and memory. So this is one of the kind of fundamental studies that shows that physical activity and exercise might actually preserve the structure of the brain. There's also been a lot of people who have been interested in brain function. So the brain's made up of many networks, and these different networks have to be able to talk to each other and share information effectively in order for people to be able to accomplish tasks without any trouble. And different areas of your brain are constantly talking to one another, even when you're at rest or when you're doing challenging tasks. So this study here on the right suggested that people who reported that they do a lot of physical activity actually had greater functional connectivity. So their brains were sharing information more quickly, suggesting that maybe physical activity has an additional kind of positive impact on the functioning or the functional connectivity of the brain. There's also been some work looking at how exercise might preserve or increase blood flow. And this seems more intuitive, I think, when we think about physical activity, like getting the blood moving. In this study here on the right, older adults were randomly allocated either to a aerobic exercise training program for 8 weeks, and then they kind of had a washout period where they didn't do anything. So they compared how did the cerebral blood flow differ. What they found was that frontal areas, there was more kind of cerebral blood flow, and these areas are important for executive function. So this study kind of showed that exercise can increase blood flow in key regions that are important for healthy aging. And finally, this is kind of the other area where exercise has been shown to be really important, is that it can uprate kind of these good chemicals or neurotransmitters in the brain. So exercise has a lot of, when you exercise, you can upregulate proteins, which are fundamental to maintaining the brain and the nervous system. One of these highlighted here is called brain-derived neurotrophic factor, or BDNF. BDNF really promotes neuron growth and survival, so it might be one of those chemicals that kind of links exercise to your brain kind of functioning at its best. So that was kind of just a quick overview of what exercise might do for the brain, but I wanted to just talk a little bit about how exercise how it actually impacts your thinking. One of the big areas people are always interested in, especially in the aging world, is how exercise might impact memory. So, like I think a lot of you know, memory has several different steps to it, and you can see those listed here. A failure at any one of these steps can disrupt the memory process. There was a recent review and meta-analysis that came out that looked at the impact of aerobic exercise on memory in older adults, and they found overall a significant positive effect size. This effect was especially pronounced in what they're calling younger, older adults and women. So we'll talk a little bit more about this with the precision medicine-based approach. The other big area where people have really taken a look at exercises with executive function. We know executive function is really important in aging because it's really been linked to independence, these kind of higher order thinking skills you can see over here on the right that help people to function well and stay independent as they age. So exercise interventions really do positively impact executive function in particular. And a lot of evidence suggests that of all the cognitive domains, this one might be the one that gets the biggest boost from being physically active. So now I wanted to switch over a little bit to talk about what a precision medicine-based approach is. The FDA defines this as like an innovative approach to tailoring disease prevention and treatment that takes into account differences in people's genetics, environment, and lifestyles. Typically, it's kind of portrayed like it is here in the figure, where the traditional approach to medicine is that we know people are different in a lot of ways, but if they present with the same symptoms, we treat them with one thing, and we see, oh, some people benefit, some people don't benefit at all. And some people actually have adverse reactions to whatever it is. So by taking a precision medicine-based approach, you're really breaking down people and considering other factors that might influence whatever the preventative thing is. In this case, we're going to be talking about physical activity. And who might it benefit most and why? So this approach really recognizes that physical activity might not work the same for everyone. And the big questions are like, who could benefit from what, why, and when? So we're going to just focus briefly on some of these factors like age, sex, genetic risk factors, race, ethnicity, and social determinants of health, and think about what the literature tells us about how physical activity may differentially impact these factors. The first factor I wanted to focus on is age. I think age is an important factor to consider because we know that increasing age is one of the greatest risk factors for the development of neurodegenerative conditions like Alzheimer's disease. You can see this displayed in the figure on the right. This was published by the Alzheimer's Association in 2024. So just increasing age kind of puts you at greater risk. So what does this mean for physical activity? When we typically look at this literature, it's mostly focused on older adulthood, but people have been interested in whether early adulthood and midlife might actually be a more critical period to intervene with physical activity. So this was a study by Zarina Krall and colleagues at the University of Michigan, where they looked at whether physical activity in early to mid-adulthood would be related to later memory outcomes. This study used the health and retirement sample. So it was a really big study where people were retrospectively reporting how much physical activity they did. What was really interesting was that they found that how physically active people reported they were in early and mid-adulthood might independently predict their memory later in life and a slower memory decline, although this was mediated by other health factors like hypertension as a key one. So a lot of the literature in this space is suggesting that when we see older adults and we might say, suggest that they be more physically active, it might be even critical to consider this with people who are even a little bit younger, as we know that some of these neurodegenerative processes might be happening, and they likely have been starting to occur decades before. So this might be a critical period to intervene. I did want to throw this in here though, because although earlier may be better, it's probably never too late. In this study presented here by Caitlin Casaletto, who is a neuropsychologist at UCSF, and colleagues, participants wore an accelerometer to track their movement for about 10 days each year for many days in later life. After their death, they donated their brains, and evidence showed that the strongest effects of physical activity were actually observed in participants who were about 0 to 2 years before death. And the average age of death in the sample was 90 years old. So this suggests that people of any age can gain benefit from physical activity, especially maybe the older that you get. So this is not to say, we saw some stuff about the importance of physical activity when you're younger, but it's probably never too late. And so this is just a little evidence for that. Also wanted to talk about another aspect of precision medicine that gets a lot of attention, which is genetic risk. We know that the ApoE gene is it puts people at greater risk for Alzheimer's disease. There's different copies of this, E2, E3, or E4. You have 2 copies. E4 is the bad one. That's the one that kind of puts you at greater risk for Alzheimer's disease. It's not deterministic in any way. It just increases your risk. And so a lot of people have been interested in how physical activity may interact with this genetic risk and be preventative. And unfortunately, this literature is really messy. Results have been kind of somewhat inconsistent, but there does appear to be a detrimental effect of that ApoE4 genotype on amyloid pathology, which is a key driver of Alzheimer's disease. And it can be counteracted by physical activity. Evidence suggests that maybe you need to get to people as quickly as you can. So if you get to people earlier in the disease process, maybe you can stop the detrimental effects of ApoE from E4 carriers from continuing. It doesn't necessarily seem that physical activity is protective enough if some of the damage in the cascade is already done. So I think that's why we see a lot of mixed literature. You can see kind of this schematic here on the right, where the green lines indicate the positive effects of physical activity and the red lines are indicating the negative effects of ApoE4. And you can see the cascade once it gets started might be might be a little bit hard to slow it down. Also wanted to just throw this in here too, because there's some evidence to suggest that ApoE4 interacts with inactivity too, so being sedentary. This study here on the right, in a cohort of community dwelling older adults, we found that being an ApoE4 carrier significantly impacted the relationship between how inactive or sedentary you were and your brain health and cognitive outcomes. Meaning that people who were ApoE4 carriers who were more sedentary had worse cognition on like naming and visual spatial abilities, and also had smaller brain volumes, so total gray matter, parietal and frontal lobe volumes. This suggests that maybe being active, not being sedentary and being active might be important for people who have this ApoE risk factor. The next aspect of precision medicine I wanted us to consider is sex differences. You can take a look here at the figure on the right and see that women are at a much greater risk for Alzheimer's disease than men. And this is a whole big area of study to try to figure out what is driving some of these sex differences. And people, of course, have been interested in that with physical activity too. There's some evidence that women may benefit differentially from exercise than men. So this here is a systematic review and meta-analysis by Cindy Barca and colleagues. They sought to really evaluate whether exercise interventions had a cognitive domain-specific function, and they also wanted to see whether there were sex differences by looking at all the different studies in this area. When they pooled all of the effect sizes together, what they found for executive function was that it seemed like aerobic training improved executive functioning compared to controls. When they did the subgroup analysis here, where you can see they looked at the breakdown of women in the studies, that it seemed that studies that had a larger number of females in them showed a greater beneficial effect, suggesting maybe that aerobic training exercise interventions might be especially helpful for women. However, when they took a look at this for episodic memory, they didn't really, they didn't see the same sex difference where women benefited more. So this just suggests that physical activity, there might be some sex differences, whereas women might benefit more in certain cognitive areas than men. But of course, this needs more exploration. There's a lot of really great people doing this work. The other thing I wanted to, another precision medicine factors, we know there's significant racial disparities in the risk for Alzheimer's disease in the US. Depicted here on the right are some projected prevalence rates of Alzheimer's disease broken down by both race, ethnicity, and then age. What you can see here is that African-American older adults and Hispanic older adults have a greater risk for Alzheimer's disease than the other groups at each of the different ages broken down here. And so it's important for us to think about what we can do about that. One big issue in the physical activity literature, like a lot of literature, is that Black older adults are severely underrepresented. So we know that Black older adults are at greater risk for chronic health conditions, including diabetes and cardiovascular disease. And this is likely related to many factors we know about, like racism, access to healthcare, education, and other resources are likely the drivers of this. Increases in physical activity have been shown to be beneficial to a lot of chronic health conditions. So given this kind of increased risk for chronic health conditions and Alzheimer's disease, it's it's really important to examine how physical activity interventions might be beneficial for underrepresented groups. And so I wanted to highlight this recent study. So this physical activity intervention was spearheaded and run by Dr. Robert Newton. He's at the Pennington Biomedical Research Center in Baton Rouge, Louisiana. And so this is some of his recent work. So this program was a 12-week trial in which African-American older adults were randomly assigned either to a successful aging group, which was kind of a control group where they just received education about like healthy living, or they were assigned to a physical activity group. And that group was supposed to do 150 minutes of moderate to vigorous physical activity and 2 strength training days with a mix of coming in to the lab and doing it and then being supervised at home. So this is a pretty intensive intervention, but the results were really promising. So they showed that when they measured how many steps were people taking and how much moderate to vigorous physical activity were they engaging in, people who were part of the physical activity group had higher step count and higher activity levels than those who just received the education. Participants also had a really high attendance regardless of what group they were in, which is really great too, because these intervention studies are notoriously hard because it involves a lot of participant burden. And the study also resulted in improved physical activity for those in the intervention group, and their satisfaction across all groups was great too. So this study suggested that future work could assess even a broader range of outcomes. So this was just assessing, did the intervention help people be more physically active? And it seems like that's the case. We could also look at other outcomes that might be positively impacted, including some of these biomarkers, brain health, cognition, things that we've been talking about before. The final kind of precision medicine factor I wanted to talk about was some social determinants of health, specifically geographic location. You can take a look here at the schematic on the right. The prevalence of many neurodegenerative conditions, including Alzheimer's disease, is not evenly distributed across the US. You can see here that there are particular areas that have higher prevalence, and a lot of these you can see are centered in more southern areas of the US. So this, I think, has the top 10 counties with the highest prevalence. You can see it's not really evenly distributed across states or across the US. And this has got a lot of people, myself included, thinking about how neighborhood disadvantage might interact with someone's ability to be physically active. So we know that the neighborhood someone lives in might exert this kind of have these contextual effects on the likelihood that the people that live there will be able to participate in physical activity. And some of these factors include walkability. So is the community that you live in, do you have sidewalks or areas to walk that you're not going to get hit by a car, that are safe, the sidewalk's not coming up to, you're going to trip over it, things like that. Do you have access to green space? So is there a park in your community? What is pollution like? Because when the air quality is not good, that also can impact your ability to be outside doing physical activity. And I think one factor to consider with this is that regular participation in physical activity is really a health privilege. So it requires some things. When people call it a lifestyle factor, I don't always really like that, because I think to be able to actively engage in this, you have to have some health privilege, including just access to resources, having money to be able to join like a gym or some kind of fitness program. You have to have the time as well to set aside to do that. And then the safety piece of it too. Like if you live in an area where it's maybe not, safe to be taking a walk outside, that's going to limit your ability to be physically active. And so neighborhood context is important to consider with physical activity because it might serve as a proxy to think about other adverse health outcomes, and it really might impact how people, how and why people are being active. So the study on the right here, I wanted to just draw your attention to. So this study, it aimed to explore the association between neighborhood deprivation and physical activity in people who had cognitive impairment already or were cognitively unimpaired. What they found was that higher neighborhood deprivation was associated with lower daily step counts, but only in the cognitively healthy folks is what they're calling them. So people without cognitive impairment. And their conclusion was that, people with cognitive impairment, they might be spending more time inside their home. They're less frequently taking trips in the surrounding area. And so that promoting physical activity within someone's home that could be accessible and inclusive might be important. So just something to consider. And so I think since a lot of us are probably neuropsychologists listening to this, what does this mean for us as clinical neuropsychologists or neuropsychologists in training? I think we need to be more aware of who could benefit from physical activity recommendations. I know at least in my area of aging, it's a big one that I always give, but thinking about who could actually truly benefit from this, and then what factors do I need to consider when I make a recommendation of physical activity. Also, spending the time when you recommend something to problem solve some of the barriers. I put some of these barriers on the right, things I've heard before, and then maybe how you can work with the patient or the client to work to try to problem solve. So when people have physical limitations, motivational issues, or what we kind of talked about, some of the social determinants of health, and how to work around that. So that's my little clinical takeaway for you all today. And then this isn't going to play because the slides don't have animation, but this was this older adult dance group that I follow on TikTok, dancing to Not Like Us. So just imagine what it is. It's pretty good. All right. And that's all I had today.
Thank you so much for your commentary on this really important subject. I really appreciate how in-depth it was. Some questions to get us started. I really thought that the map of the social determinants of health was really interesting. And I was wondering if you could speak a little bit beyond what you'd shared, more about how perhaps toxins and chemicals may impact cognition and later in life, and how maybe inability to access cleaner neighborhoods may impact this. And I know a lot of people these days are talking about microplastics and water quality, for instance, such as in Flint, Michigan. Can you speak a little bit more to that?
Yeah, I think it's slightly outside of what I do, but I know that thinking about how the environment that you live in could put you at greater risk is a really important thing to do. And neighborhood is just one way to get at that. Like you mentioned, there's so many things that go into where you live, like the quality of the water, the quality of the air, access to food. I've noticed in my clinical practice, we don't do this yet where I work, but I have seen records from other places where they calculate the area deprivation index as part of their medical chart, which I think is really a great idea and super interesting, because then you can get a sense for what the neighborhood is like that someone lives in if you don't just know because you're from the area or familiar with what it is. So I thought, ooh, that's a really great idea. If we saw patients and we had their ADI already available, maybe we could think about some more of this stuff, which I think would be good.
Yeah, I think that's really interesting how you mentioned that people are starting to incorporate this into medical chart review and allowing that to be part of the overall health and wellness picture that we have for an individual that we're seeing, because it really is about looking at cognitive strengths and weaknesses, what's intact, what's not so much, in the context of their environment and past environments as well, because people move around.
Yep.
Yeah. Another question that came up was, how does fear and stigma around aging factor into some of these concepts?
I think that's a really great question. I was reading something that said that ageism is one of the most prevalent of the isms because older adults are present everywhere, and we have these ideas about what they can and can't do, and it contributes to some of the stigma and negative outcomes for people. So I think, especially with physical activity, while it is important to consider someone's age and physical functioning, because you wouldn't want to recommend something that could be harmful for them or that they wouldn't be able to do. But you also don't want to think because they're older that they can't do anything or really limit unfairly, I guess. So I think that's one way that can play into this, is not expecting that people can do as much as they can.
Yeah, absolutely. And I think, there's also, from a professional perspective, this ethical piece of like recognizing like what people can actually do, but also not over pathologizing and like recommending more than maybe what they can do. And, then there's this ethical piece that can maybe come back and harm us in our practice. But, and you've been in this field much longer than myself. To what instance do you feel like that ageism kind of factors into neuropsychological practice in working with older people, which really is kind of like the bulk of what we do?
Yeah, I think that's a really great question. Working with older adults, I think it's really important to be aware of your own biases and just society's biases of ageism, because a lot of times the question is, at least some of the referrals I get are like, can this person like make medical decisions for themselves, or can they be living alone, or and I think like you need to be really sure that they can't do something before you recommend that, because somebody's independence and ability to make decisions for themselves is like so critical. And so I think that's one area that can come up in is, if somebody has some scores that are maybe not amazing, and now people are wondering like, yeah, should they be living alone or making decisions for themselves? But we have to recognize that like our tests are not a perfect measure of some of that stuff. So being more detailed with that.
Yeah, absolutely. And I think it's, one of those things that, we have these norms, but it's so expensive and it just takes so long to re-norm things, which is why a lot of the norms that we use are outdated. And so I think that we're kind of at this crest, if you will, and really needing new norms as we're starting to consider things like super aging and the impact of technology and social media on cognition. We have people that are living longer, older, more independently for longer periods of time. And I think that this plus this increased diagnosis rate of Alzheimer's by 2050 is something that is really going to change the way that perhaps the field looks at aging.
Definitely.
Absolutely.
Yeah, we need better norms.
Yeah. And that's the thing that we can say over and over and over again until we're blue in the face.
Yeah.
Yeah. It's a whole process. It's not the most efficient process, but it's the process that we have at the moment. I was wondering what your thoughts were in addressing some of these issues more systemically. What can neuropsychologists do more outside of the clinic, outside of diagnosing people, to address some of these more systemic concerns? I think that neuropsychology is very much, you come to us when you're not feeling well, but what can we do to get ahead of that?
Yeah, I think we have to be more accessible, like to people in the community. And so I know like sometimes it like, for instance, through our Alzheimer's Disease Research Center, outreach is like a really important thing. And so trying to get in the community and do these like health screenings. And so part of that is a neuropsychologist who gives like a MOCA or an MMSC and then tries to direct people towards resources either way, like depending on how the screener goes.
Mhm.
I think that's one way I've seen that it's less scary and it helps people be more comfortable and access resources that maybe they wouldn't be able to get to.
Right.
So that would be one thing, I think.
Mm-hmm. Yeah, I think that, this piece of accessibility is, certainly important, and, there aren't enough of us to begin with. So how can we kind of get more people into the field as well? I think is part of that too.
Yeah, that's probably a whole other thing. Like, how do we make this training more accessible and like increase the pipeline of people?
Right. I think that this piece with exercise is really interesting that you had presented about, particularly about a precision medicine approach, and really kind of tailoring things and kind of recognizing that, particularly across like sex and gender, that exercise will impact people differently. And it kind of made me think about even just like how you were saying that there's different factors that may impact exercise between men and women. It also got me thinking possibly maybe like a hormonal effect too. We know that women who breastfeed actually have better improved cognition when they're over 50. That's been shown in a few studies, but it can also just open up this other whole conversation about neuroendocrinology as well and the impact that has. And, we know that hormones are going to fluctuate, wax and wane across lifetime. But I was wondering about how a precision medicine approach with exercise may impact that in how we age, particularly from the perspective of gender. If you know any, if you have any thoughts or comments about that, what you might say to somebody who is a middle-aged woman, like you were saying, in the middle-aged, that exercise may be more beneficial at that point in time. What might you say to somebody from that perspective?
Yeah, I think that's a really great point. The big piece that's missing is like the mechanism. I think there's so many great people out there who are trying to, like you said, find what is the mechanism that maybe makes it more beneficial. But I think if I had a patient who was a middle-aged woman who had, risk factors and had some cognitive concerns, that I would want to recommend physical activity. And I might frame it as, you might get some kind of additional boost out of this. Like, we know that there's evidence to suggest that. So it might be even really especially important for you that you might, it might give you your brain a little boost. But it would be hard to explain why, because I think we're still working out the biological piece of it.
Absolutely. And, it's interesting because we also know that exercise is so good for impacting mood. Like, we know that regular cardiovascular exercise can be as effective as regular use of serotonin reuptake inhibitors, which are first-line treatments for depression. And we also know that depression is also a risk factor for cognitive decline later in life, particularly when left untreated for a long period of time. So, there could also even just be like, a psychological connection there too, in terms of how other mental health factors are impacting cognition and how exercise may be moderating the strength of that observed effect.
Totally. Yeah. You bring up a great point with exercise and mood. That's one piece I just left out because I didn't think there'd be enough time with that, but that's a huge piece of it. So that might be another, and when your depression puts you at greater risk for neurodegeneration too. So it's all good stuff. And maybe, there's probably multiple pathways that get you to the same endpoint, maybe.
Yeah. Another question that popped up too was chronic pain across a lifetime. And as we age, chronic pain becomes more and more of something that people are more likely to live with as a part of their reality. Whether it's my hip got replaced, or I fell, or an injury from before starting to creep back up on us, or even just like age-related aches and pains. I'm wondering in the way in which exercise to a level that's beneficial may be adjusted, or if the amount of appropriate exercise to have cognitive benefits changes, or the type of exercise for cognitive benefits changes as we age to account for perhaps less output or less physical abilities as we age. What are some of your thoughts about that? Has the literature said anything about that? How much exercise are these 70 and 80-year-old people in the literature doing compared to 30-somethings that may be receiving executive functioning benefits, as you say?
Yeah, that's a really great question. In a population with chronic fatigue, I think you have to be really careful about what you're recommending. And of course, you'd want like their physician, whatever their guidance was, for them to follow that as well. One alternative to some of the more traditional exercises we think about, it would be something that's a little bit softer on people's joints. So for instance, at the clinic I work at, we have an integrative medicine center where they do water-based physical activity. So it's kind of like PT, but they do it in the water. So it's really great for people who have chronic pain or balance issues, where traditional like walking or biking or other weightlifting like isn't really an option for them because of the pain or other physical limitations. So water is one way, although that's not always accessible to everybody. So that would be one thing. And then I think you mentioned kind of like how much and what type, and that's a great question too. So there's a lot of people who've been kind of pinning head to head, like aerobic exercise versus resistant exercise, like weights, versus what we call multi-component, which contains usually like physical activity with some kind of like cognitive piece to it. So dance would be an example of that, yoga, tai chi. And when they put these all head to head, they seem to do pretty similar to each other, which I think is good in some ways, because it means that, you don't necessarily have to be running or walking briskly. Like you could do yoga or tai chi, which has is still challenging, but has less of an aerobic piece to it. Also has this kind of like thinking mindfulness piece to it. And that might be good enough. And so I think we need more evidence for, how much and when, but there is some to suggest that like the type, they could all be beneficial.
Yeah, absolutely. And that's always like such a $1 million question, like how much, how frequently to get the results. And I ask that anyway because I'd love for people to hear you share that. But to follow up, really exercise in any amount, in any form, as long as it's not injuring you, is good for our bodies. And I think that piece of we're seeing similar results, similar effect sizes across different types is really important, because as we switch from different exercises on different days, that's also cognitively stimulating as well. Also, it gives people options. And, even the pain rehabilitation outpatient program that I work at, the outpatient program starts every single day with like an hour of Tai Chi, and it's like great for your body. It's like super easy on your joints, and people may look at it and be like, oh, that's not real exercise, but it's like you're still moving your body. Like it's good for your body. It's really great. But so I really liked that response that you gave of like, essentially like moving in any amount is good for us and is better than nothing.
Yes.
Yeah.
Definitely.
Yeah. Well, I think that we will stop there for now. And I just want to reiterate how grateful we are to have you share your thoughts with us on a precision medicine approach to neurodegenerative diseases, particularly Alzheimer's and aging, and putting all of those things into context.
Thank you so much. I really do appreciate the opportunity to present this week.
Absolutely. You did a great job fielding those questions and summarizing a very large emerging body of research. And I look forward to finding that TikTok video and watching on my own time.
I'll send it to you.
Absolutely.
All right. Thank you.
Thank you.
See you later.